So the modalities that I had was whirlpool. The article that I looked at was the effects of whirlpool bath and neuromuscular electrical stimulation on complex regional pain syndrome. The authors were Gul, Dervishmal, Aysgul, Turkilmos, Murat Yildirim, and Manur Binzala. It was published in 2015. It is a level 2 evidence due to it being under 100 subjects and not doing a power analysis. This was a randomized controlled trial and did use a pre-test, post-test control group design. So the focus question that the authors looked at is, would whirlpool bath or neuromuscular electrical stimulation show greater improvements in strength, range of motion, and pain, and also decrease in edema in patients with complex regional pain syndrome. For the inclusion criteria, the authors wanted only patients who had been diagnosed with type 1 of CRPS and be in the first stage as defined by the Budapest criteria. And patients were also only allowed to take 500 milligrams 3 times daily of an analgesia. For the exclusion criteria, patients were not able to have any open wounds or any hand fractures. They also could not have any nerve lesions or peripheral neuropathy, and they could not have a diagnosis of any systemic diseases such as diabetes mellitus or currently have any infections. Overall, there was 2 groups that were randomly assigned. There was a total of 60 participants. 30 participants were in the whirlpool group and 30 participants were in the neuromuscular electrical stimulation. The whirlpool group received therapy over 15 sessions, which occurred 5 days a week for 3 weeks. They received a 30-minute whirlpool bath where their hands and wrists were submerged using a Cyrone cauldron. And after that, they received underwater ultrasound therapy that was completed on the hands and wrists for 5 minutes. The intensity was set at 1.5 watts per centimeter squared, and the probe was 1 to 2.5 centimeters away from the wrists and hands while underwater. After the ultrasound, they also performed an arrangement of stretching and range of motion exercises during each treatment session. The second group, which was the neuromuscular electrical stimulation group, also received the same strength and range of motion exercises along with the underwater ultrasound, but this group received the neuromuscular electrical stimulation using a CFAR device where pulses were applied for 300 milliseconds at 30 hertz frequency. The flexor muscles of the hand were treated for 20 minutes first, and then followed by 20 minutes on the extensor muscles of the hand. So the outcomes that were used during this study was hand edema was measured by a hand volumetrics, grip strength was evaluated using a hand dynamometer, range of motion of the flexors and extensor muscles of the wrist were measured using a hand goniometer. Distance from the finger to palm crease was measured using a ruler. Pain was measured using a visual analog scale, and 3 different pinches were measured using a manual pinch meter. The authors concluded that although both groups showed improvements in post-intervention results, the whirlpool group had significantly better improvements in hand edema, grip strength, range of motion for the flexors and extensors of the wrist, pain level decreased, distance from the fingertip to distal palmar crease increased, and the lateral pinch test also increased. Both interventions, though, could be used to help relieve pain, decrease edema, and increase range of motion and strength in a patient's hand and arm that has been diagnosed with complex regional pain syndrome. There were a number of strengths and weaknesses for the study. One of the major strengths of this study was the author's use of reliable and valid outcome measures, and they also did a randomized controlled trial. The authors also provided detailed information on all of their equipment, including the make and model, and they also provided adequate background information and used a clear justification for the need for this study. Some of the limitations that were involved included not doing a power analysis. They also did not provide any information on who was completing the interventions or the assessments and if they had any prior training completed. There was also no true control groups, and both groups received more than intervention, which could have made some bias with the results. Overall, this study shows the importance of using modalities such as Whirlpool in patients with complex regional pain syndrome in decreasing their pain and edema and also helping to increase their range of motion. This can help improve their functional limitations since they could have less pain when using their hands to make a meal, and the greater range of motion would make it easier to get dressed, which is really important in the field of occupational therapy. This study was really relevant to the field of occupational therapy due to the modalities that they use are commonly used in our clinics and are available for use, and the outcome measures they use were also common and realistic measures that we test on every patient. If I had a patient come into the clinic who was diagnosed with CRPS and Whirlpool therapy was appropriate to use, I think this could be a great modalities to start the session with, especially if you have a longer treatment time. It can help you have such important gains that could help you in your therapy treatment when you're starting to work on those functional activities. And based on the results of this study, if the Whirlpool wasn't available or if the client didn't want to participate in it, I think you could also suggest the neuromuscular electrical stimulation, since it also did increase benefits, although not as much as the Whirlpool.